Welcome to our series on healing thoughts. This is number 9. Today we're going to talk about osteoarthritis and posture. The joints consist of bones moving and coating the bone is a layer of cartilage, which makes the movement smooth and reduces friction. So there is a layer of cartilage and a membrane and the bone underneath. And normally we can move our joints without any pain and without any limitation. Let's assume that you're 20 years old and have normal joints. Why is it that at age 70, you will hardly be able to walk? You have pain in your knees when you move around. You're comfortable sitting down, but then when you get up, oh, it's so bad. And you go to the doctor, and the x-rays show that instead of the space between the bones where the cartilage is, the bones are rubbing each other. And when they rub each other, that friction is very painful. And at the age of 70, now you are looking ahead to knee replacement surgery. You have gone 70 years gradually destroying your joints, and now you need new ones. What can we do about that? What's going on here? Damage to the knees, for instance, or the back or the shoulders, there can be several causes of that. The first is physical damage. A football player, a hockey player, is pounding and pounding on the knees and getting tackled and thrown down. That can injure the knees. Physical activity that is traumatic damages joints. Sandy Koufax, the famous pitcher for the Dodgers, ruined his shoulder from pitching his famous accurate pitches. Even a marathon runner running on that hard pavement day after day after day is going to traumatize and can potentially damage the knees. In terms of posture, one of the common causes of knee arthritis is what we call an anterior pelvic tilt. As the person gains weight and you have a heavy tummy and the tummy pulls you forward, you push back, but your pelvis, your feet go out and your pelvis tilts forward. Now, what does that have to do with the knee? Well, this is interesting. Okay. When you bend your elbow or your knee, whatever, it's a hinge joint. It's supposed to be straight. However, when you have your feet out and your knees are going outward and you start walking straight, you are wearing down one side of your knee. That twist that is being pushed to walk is wearing down that cartilage. And over many years, particularly if you're overweight and having this pattern, it wears down to the point that the bones rub and you have painful arthritis that's causing distress. Okay. The ladies who for years and years have high heels on, that can put pressure on the toes and damage the foot. And the leaning forward causes her to compensate, twist her back backwards, and that also puts pressure and can damage the spine. Well, what happens in the spine? When there is a twist or a turn that rubs and wears down the cartilage, when that bone rubs against another bone, it triggers a healing response and the bone thickens. So in an attempt to heal itself, the bone, in replacing the cartilage, is growing more bone, and then eventually it can pinch nerves in the back and cause leg pain or arm pain. Okay. Now, in California, there is a physical therapist called Peter Egoscue, and he was in the military, I believe in the Korean War, and had a severe injury to his back and was in pain for a long time. And he took this up as a personal interest and studied functional anatomy, big words for that. And he made an analysis of why certain postures cause pain. He noted that when a person was injured, if you broke your leg or you had an operation and the leg was shortened, or something compensating like that, in order to get around that, the body adjusts its posture to compensate. So for instance, if we are weak on the left side and we compensate on the right or whatever, we're going to have tighter muscles on one side or the other. We're going to have stronger muscles on one side or the other. And that those twists of your spine, of your shoulders, of your hips, of your knees, that wears it down and can cause pain. Sometimes, in addition to degenerative arthritis, the wearing down of the cartilage and the stimulation of bone, sometimes there is inflammation on top of that. And in terms of anatomy, the lining of a joint is structurally similar to a sinus in your head. Now, in the joints, there is a layer of cells, and that has to be lubricated with liquid. But if we have some junk in the system, and you've had a scar tissue or something in the joint, that can be a focus to accumulate junk and cause breakdown of tissue and inflammation. The disease called rheumatoid arthritis is a disease in which the immune system is directly attacking the tissue in the joint to cause inflammation and damage. Okay. Everybody is going to have some degeneration of their bodies over time. we wear out our bodies. That's what they're here for. And in my case, you know, I slouch a little bit, and I've had a kind of a crooked kind of thing. And the way I'm kind of reading a lot and crouched over a desk, writing notes as a doctor kind of thing. So you become what you are. Now, Pete Egoscue developed something called the Egoscue method that counteracted this. He based his exercises on yoga postures, and he said, okay, if I'm all hunched over most of the time and I'm inactive, I have to counteract that. Now you have a lady who works in an office and is typing all day, and her range of motion of her arms are basically at the keyboard. Now, if she wants to put her curtains up or cleans her windows and has not raised her arm for a long time, when she does that, she could get a strain and injury. So Egoscue set up some exercises, simple exercises to do to stimulate the muscles that are underutilized in your body and have an improved range of motion in your neck, in your shoulders, in your hips, in your knees, in your feet. And if we are crooked and we counteract that, it maintains our function and doesn't allow, you know, tries to counteract just deterioration and disuse atrophy. When you have a limitation and you give up on it, for instance, a person has a stroke and they're weak. They still have nerves that are functioning there, but they're going to have to use it and maximize so that they can recover from the stroke. If they give up on themselves and don't ever activate the muscles and the nerves that are still there, those nerves are going to die or, you know, just deteriorate, and you won't be able to do anything. So the first principle here is, even if you have arthritis, let us exercise our joints and do things that preserve our function, even if we have some limitations. And hopefully, if we maintain that kind of activity, we can prevent some of this. Okay, so I'm not going to give you a physical therapy thing, but for basic principles, there's things like facing the wall and raising your arms all the way up and holding that for a minute, and then holding it like this for a minute, and then holding it out for a minute. There is an exercise at the wall. You're going to go up on your toes, up and down, where the toes are front, pigeon-toed, and everted outward. Just exercising those kind of things stimulate the muscle and move the joints in the ideal directions. When I went for therapy to the Egoscue clinic, the therapist himself had a deformity of his hip, and he couldn't do all the exercises he was advocating. And then I said, well, why do you do that? He says, you want, even if you're limited, if you don't use it to the max, if you just neglect it, it's not going to do anything. But if you use it, you will maintain as much strength and activity as possible. If you are interested in that kind of thing, Peter Agostio has a book called Pain Free that shows pictures of this. But from my experience, yoga is also a wonderful way to maintain body function, stretching, strength, and endurance. So that's something that you might want to consider. Now, we take a snapshot of ourselves and we say, oh my goodness, I can't do this, I can't do this. Well, let's take an inventory of your physical functions. Do you have any joints that are painful? Do you have any joints that are stiff? Do you have a range of motion that's normal or abnormal? Can you I mean, I have a little frozen shoulder thing, so I can't go all the way back. And let's accept ourselves the way we are. That's our baseline. Okay. How are we going to improve? We will want to begin to use the body in the to maximize function. Can we, in the past, the farmers, the pioneers did a lot of physical labor. But nowadays, we're lazy. We get other people to do things for ourselves. And what we want to do, instead of sitting all day watching TV and then going to the gym to have a workout, we want to incorporate in our day-to-day activity physical activities that maintain function. I mean, okay, so if you analyze the mobility in your day-to-day life, do you take walks? Do you climb stairs? Can you, if you are on the floor, can you get up without help? Do you have flexibility? Are you crouched over? Are you having difficulty walking? Well, then see how much you can stretch, see what the limits of your mobility are, and try to maintain it. I recommend as an ideal to strive for your ideal weight and your ideal metabolism. So if a person has back pain and knee pain and is overweight, in addition to doing the exercise that they can't yet, that you can, we would want to make changes in your diet so that we slowly get rid of and reduce the burden on your joints. Being active and physically walking and doing things is very important in losing weight because it mobilizes parts of the body and pushes junk out, and the caloric consumption burns up fat and other things. We want to right now you may depend a lot on medicine to get through the day for joint pain, back pain, things like that. Obviously, you may have to take that, but the question is if you can increase your activity, increase your mobility, and and improve that situation. In summary, your body is an instrument that you have learned to use. And unfortunately, many of us abuse our bodies. And if we're mindful of their capacity, their adaptability, and their value, we will kind of rewrite our user manual on ourselves and see the deficiencies that we have and take steps to improve our use of our body, to get fresh air, to get outside, to walk as much as we can, to eat foods that are in keeping with nature, to restrain ourselves from dangerous activities and risky activities. Many older people will have accidents and die and fall and break their hips. You have this elderly woman, widow, living alone, and wow, she climbs the stairs, she cleans, she cooks, she's active, her daily activities becomes her life, and she's proud of it, and she keeps going, and she's up to her potential. That is wonderful. She should get a medal. She should get praise for that, because we don't want to foster dependence. Even when we have a person who's had a stroke or has arthritis, instead of just sitting there and doing everything for them, see what they can do for themselves. Get the range of their participation increased so that they can be more independent. This concludes our discussion today, and I would suggest that you kind of make an inventory of your physical capacity, your range of motion, what you can and cannot do, and then make a plan to address that and improve your physical capacity. Thank you.